Hi everyone, thanks for joining us and welcome to today's webinar. We're going to get started shortly in just a couple of minutes, so just hang tight and I'll talk to you soon. Thanks. Hi everyone and welcome to FARE's free monthly webinar series. My name is Carrie Mulkowski. I'm a National Programs Manager here at FARE and I'll be your moderator for today's presentation, which is titled The FARE Patient Registry, Enhancing Patient Engagement Through a Robust Registry. So just a little bit of housekeeping before we get started. This presentation will be recorded and posted on the FARE website in about 7 to 10 days. Also, please note that for maintaining a quality recording, all attendees will be muted throughout the webinar. However, you can still submit questions throughout the broadcast by using both the questions and chat features in the GoToWebinar toolbar that you'll find on the right-hand side of your screen. If time permits at the end, we will respond to some moderated questions for our presenter, so please do chat those into us. For those of you who are on Twitter, we encourage you to join us in conversation during the broadcast. You can follow along with our webinar live tweets at our handle @FoodAllergy or #FareWebinar. So today's session will be on FARE's Patient Registry, a valuable tool that can help to further our understanding of food allergy, advance research, lead the way for discovery of new treatments, and improve patient care. Our speaker today is Dr. Luis Garcia. Luis is the Patient Registry Director for FARE and plays a key role in the creation and implementation of the FARE Patient Registry, including platform and survey development, data curation, and working closely with technology vendors and FARE's Medical Advisory Board. Luis has a diverse background, including work in clinical research and experience as a Clinical Registry Manager. He previously worked as a Professor of Medical Sciences. He completed his pre-medical studies at Florida International University. Later, he went on to receive a Doctor of Medicine degree from Universidad IberoAmericana. At this time, I am very delighted to turn the presentation over to Luis.
Hi, good afternoon, everyone, and thank you to everyone who joined us today for this informational webinar. So today I'm going to talk about the FARE Patient Registry tool and how we're using it to enhance patient engagement and patient-centered research. this is a real exciting and ambitious project that we've started at FARE, and I'm sure some of you or many of you have received our emails asking you to participate, so I hope this webinar session can clarify some questions that you may have. Now, before we begin, we realized at FARE that the shortage of data that exists about food allergy patients was mainly a technology problem. So to correct this, we wanted to amass a vast collection of patient data that would allow for a large-scale, long-term study on food allergy patients. Now, for this to become a reality, we need to survey thousands of patients. And once we do, all the evidence that we collect will be transparent as we plan to make it accessible to everyone. So we hope you find this webinar informative. And well, again, we'll save some questions for the end of the presentation. Now, these are some of the topics we'll be discussing today. So we'll address some of the research challenges that we're facing, and then we'll go on to talk about what a patient registry is, our purpose, who should participate, and some other information. Now, first, we have a request. So far, we've collected some real incredible data since we launched the FARE Patient Registry. We have over 2,800 patients that are enrolled. However, we need to grow the registry further because generally, more data means greater and faster opportunities for breakthroughs. So when we launched the registry in May of this year, it was launched as an opt-in registry, but now we've become an IRB-approved study, and we need all the previous registrants to confirm once again their agreement to participate in the registry. So if you're already enrolled in the registry, thank you very much. We just need you to come back one more time and reconsent. This is simple. To do this, just log into your registry account on foodallergypatientregistry.org, and then you'll be directed to complete the updated consent form. If you have registered more than one patient, just go ahead and reconsent each patient separately. The steps for that are very simple. Once again, log into your profile with a username and password. If you do not remember your either username or password, you can use the password recovery function on the login page. Once you're on your profile page, just update your consent by checking the boxes for the new study at the bottom of the page. So you'll see that in the top of the slide. So you check those 4 boxes, and then that'll lead you to your Assent survey in the medical surveys box. Just select one answer for that survey, click the next button, and you're all finished. So this process should take you 1 or 2 minutes tops. Now, for those of you that are new to the patient registry, or for those of you that just want more information on the patient registry, these are some of the research challenges that we are facing. Like I said before, there's a general lack of data in food allergies, and very little is known about the effect food allergies has on individuals. And this is exactly what we're trying to do with the registry. We're trying to fill that gap with data that we collect from our participants. But also, a lot of the data that's generated at hospitals generally stays in one place. And this causes what I call a fragmentation of data. And when you have this, it prevents researchers and clinicians from making full use of the data. So without a way to integrate and analyze the data, doctors, researchers, anyone that would benefit from using this data generally miss the big picture perspectives they would need so they can pursue some of those important goals they're after. So to solve this, a patient registry integrates and centralizes patient data. So this is the main reason why it's important that we create one single, comprehensive, national food allergy registry so we can encourage collaboration between those institutions and providers that currently treat food allergy patients. So a national patient registry is very important because it's going to help answer questions that can't be done at local levels or can't be done at the levels of hospitals. And questions that we need answers to urgently, like the frequency, severity of food allergic reactions, but also general data on prevalence rates and other information. But going back to the issue on fragmentation of data, this fragmentation also creates, once again, that lack of collaboration between the data site and also the research teams. Just because if the data is fragmented and distributed in different locations, it makes it very difficult to share that information with researchers for them to do their studies. And in some, patient registries can be crucial in overcoming this challenge. Because again, our focus is centralizing all this information, analyzing the data, and then making that information available to researchers. But also, one last problem I'd like to address is patients are also located around the studies, and when it comes to enrolling in studies, not all hospitals participate in all studies and clinical trials, so this also causes recruitment difficulties, and that can lead to a misrepresentation of the food allergy population. Now, a registry will allow patients to participate regardless of where you live and regardless of where you're being treated, and we'll get into that in a few slides. Okay? The last point I want to touch on also is patient recruitment for studies, once again, occurs at many levels, different hospitals and clinical centers, but then that can create a substantial cost and effort for patients, and that can also limit participation. So our registry model is structured so we can recruit patients online using a secure web-based platform. And that's going to bring no cost to the patient, and hopefully it'll make it very convenient for all patients to participate. And right now we know that many patients are eager to participate. Now, what exactly is a patient registry? So a widely used definition for patient registries is that of an organized system that uses observational study methods to collect uniform data that can be clinical or other data, and they're used to evaluate specific outcomes for a population defined by a particular disease. So this is a practical definition of it. In our case, our population are food allergy patients. Now, to expand on that, registries are what we call non-interventional studies, and they are also considered minimal risk studies. So that means that there will be no predetermined hospital visits, no drugs or procedures are being tested, and also no needles for kids and for patients. So we're strictly interested in patient data. Overall, registries simply watch, collect, and analyze data, and the goal is measuring the current standard of care and then providing guidelines for improving that care. So registries are basically repositories of medical information, and many patients already exist for different disease communities, and they've been able to provide a medium for breakthroughs. So I feel like it's important for the food allergy community to have a registry as well. Now, we're looking at the purpose of a registry, specifically for our food allergy community. It's important to know that the registries need to be shaped by the patient voice, so the information that we collect is relevant, and it's also useful for everyone. So our main goal here is to provide, number one, the solution to the shortage of data by, again, creating not just a large, but a national repository of data that we can use in research. But once we do this, this is going to allow us to accomplish other goals. Like, for example, we can increase direct patient engagement in research. So this is really at the core of what we're trying to accomplish and the title of the presentation today. But once we have this national repository, we can use it to advance scientific understanding of food allergies and patient care. And we do this primarily by using big data and then analyzing this data. And once again, the research we conduct with the registry is always patient-centered. Now, once we have this data, our goal is to make that data available to researchers, but in a de-identified fashion. So that is, all the data that contains any identifiable information about the patient is removed. So things like name, addresses, phone numbers, all that stuff is removed. Lastly, we want to use the registry to attract investigators to the field. Through other innovations at FARE, such as the Investigator Career Award, we help invite and encourage new researchers to study food allergies by providing funding for them to do their research. But now we want to add to that that we also want to provide the data so they can perform the studies. The last point I want to touch on is also, once again, we want to streamline data collection. So there's all this data that's generated on multiple sites, but again, it's fragmented and it becomes difficult to use. And in doing so, we can overcome some of those research challenges and again, provide a solution to that fragmentation of data. So what exactly do we do with the data? The data we'll collect will be used to support basic research, but other studies, including health, social services planning, and also demonstrating specific patient needs. And with the registry, we want to look at the unmet needs of the patient and also look at some unknown variables that no one's studying yet. Now, to do this, we will accomplish this partly by enrolling patients at any of our 29 sites within the FARE clinical network. And as you may know, the network was created in 2015 with the goal of raising the quality of care, but also reducing discrepancy amongst providers. So no matter where you visit, you're receiving the same standard of care. And this year, I'm happy to announce that we expanded the network to 29 sites of excellence. However, you need not visit a center of excellence to be enrolled in our study like traditional studies. Remember, you can also do this online and anywhere. So generally, there are different types of registries, and I can spend probably a whole afternoon talking about all the different kinds of registries. But if I can sum them up in two categories, the main registries collect either patient self-reported data and also doctor-reported data. So with the FARE Patient Registry, we decided to combine both platforms, and then hopefully, in providing both sets of information to researchers, we're giving them all the data that they need. And because we're collecting patient self-reported data, the patients will be engaged directly in this part of the registry. And again, we'll talk about what that's like in a couple of slides. So once again, we're collecting patient-reported data, and then we're going to combine that with clinical data that we collect from participating FCN centers. So what kind of information do we want to collect? Now remember that you as a patient, you're the expert of your disease, so you can share important information about things, for example, like the natural history of the disease, the types of food allergies you have, the disease severity, comorbidities, and just other information that you generally can extract from clinical records. So moving on. Who can participate? We structured the study so that anyone with a food allergy can participate. And this is important because we really want to have an accurate representation of the real-world population of food allergy patients. So those with mild to severe reactions, those with multiple allergens, and even those that have past allergens they have outgrown, we invite all of those groups to participate in the registry. I feel like it's very important that we have and we collect information on the full spectrum of severity of reactions to patients, so we can really reflect that food allergy population. Now, how exactly will patients contribute? Now, patients are no longer viewed as just subjects in clinical trials like traditionally done, but now they're actively seeking to share their personal health data. And personally, I know many patients are very engaged in research, and they also want to become partners in research and get involved. So the question becomes, what can you do as a patient to support research? Well, initially, I like to say that you can become by starting a research advocate. And what exactly is a research advocate? So we're looking for participants that want to provide longitudinal data, and this is from your personal experiences with food allergies. So that means that you're committed to share data over time, and this is what's important about registries. We can study the food allergy disease from onset to hopefully when a patient develops tolerance. And you do this by coming back and answering surveys. But you can also help by recruiting patients to participate and also spreading the word about the study. But your main contribution will come from completing our surveys, and these are surveys that were written to capture data from or about your personal experiences. And again, we want to combine that together with clinical information. Next, within our surveys, you can tell us when you have a reaction, and I feel like it's critical for researchers to know why you have an accidental reaction, and also when, and anytime you visit the ER, and what happened there during that visit. But through the registry also, we hope to encourage that patients will be able to participate in clinical studies, which is the only real way to develop new therapeutics. And lastly, I encourage patients that participate to stay in touch and provide feedback, but also check back often for surveys. The only commitment we ask of you after registration is maybe 15 or 20 minutes, maybe 2 or 3 times a year to complete our surveys. And when you do, they don't need to be completed at once. You can complete as much as you want and then come back and finish the rest later. So, and speaking on our surveys, right now we have 2 surveys on the website. You'll start by completing the food allergy initial survey, which is a basic, what we call a food allergy 101, just detailing your experiences with food allergy. So this is where we want to learn what you're allergic to, what kind of treatments you receive, when you were diagnosed, who diagnosed you, and just other basic demographic and history information from the patients. Next, we have the My Reactions Exposure Survey, and this is where we can track past or recent reactions that were caused by accidental exposures. And again, this is where we really want to capture data on mild to even severe reactions. So remember, there's no such thing as a mild food allergy, but there are mild reactions, and we like to collect data on that. So again, we'll have more surveys coming in the future. Now, once you join, you'll be taken through the simple account creation flow. And creating the account is very quick and it's very easy. And once you do, you'll have access to your own patient portal. So once you access the site through the homepage and you register, you'll provide information on whomever the account holder is, whether it's you, the participant, or if it's you as a parent creating accounts for your children. Next, we'll ask you to provide information on the participant. Now, if you happen to have multiple children that you want to enter, you can just enter the first child, and we'll show you later on how you can enter multiple children under one account. Next, we'll take you through a brief consent process where you provide your agreement to participate in the study, and you'll be asked also to complete surveys, and then you'll have access to your own patient portal. So once on the patient portal, you can do one of a few things. Number one, and very importantly, you can tell us where you receive care. So who is your healthcare provider? Who is your allergist or immunologist or pediatrician or doctor that's providing care for you or your child? We also give you the option to upload medical documents. So if you have test results showing diagnostic criteria or other information, we give you that option there. And in the family members box, if you have multiple children, you have the option also to add all those family members under one single account, just making it very easy to log in and keep track of everything you do. But again, as an advocate, we invite you to, and we ask you to invite others and make others aware of the research study. Now, a really exciting feature about the registry is the View Data feature. Once you've answered either one or both or all of the surveys, you'll have access to view aggregated responses from all participants to all the survey questions. So I think this is a very neat feature. And starting in January of next year, we're actually planning on expanding this view data function so we can create a more enhanced user experience. Now, in looking at some of the data that we've collected, so far we have participants from over 20 countries, so we're receiving a very good distribution of data from a wide demographic range of patients. And if we take a closer look at North American patients, you see that patients with food allergy live throughout the states. And Hawaii is included here. It's not shown on the map, but we have some patients from Hawaii. But so far, we have no patients from Alaska. So if you know anyone or have any friends that live in Alaska, please get the word out. So again, we have close to 3,000 patients, but we need more data. And really, we need as close to 10,000 patients to provide their feedback. So the data that we collect is representative of what we say is our 15 million patient population with food allergies. So let's again look at some of the data that we've collected so far. Now, for the most part, it seems that it's the mothers that are completing the surveys for their children, and we have about 1,400 responses for that. So I feel like the fathers need to catch up. But if we look at this chart, you know, we can also extract some important data, and this is where data analysis becomes pivotal. So this chart is also saying that most of the data and most of the responses is coming from children, and we're collecting less data from the adult population. You can see that here under the patient or self-responses. And this is something that's been addressed before in food allergy research, which is a general lack of data for adults. Now here we can see the age were symptoms first developed in children. So the data we're collecting so far shows, which is what's in line with what's currently known, is that symptoms show up early in life. So we have most of these responses from birth all the way to about 1 year old, and then it starts to taper down. Now, for the age of diagnosis, we had over 2,000 responses to this question, and it shows that most of the patients were diagnosed before the age of 5 years old. Of these 2,000 responses, almost 500 responses were at 1 year old. So I wonder, what's happening in the period before patients are diagnosed? So is this showing us an opportunity where we need to educate parents more on recognizing the early symptoms of food allergies? So this is just an example of just some of the things that we can do simply by collecting patient data from our participants. All right? So what are you all allergic to? So generally, everyone's familiar with the top 8 allergens, but here at the bottom, you can see also that we have a growing number of other significant food allergies. Of course, peanut is taking the lead with about 1,500 responses, and tree nuts, we've had about 1,350 responses. But we've also collected some good data on fruits and seeds as being allergens of concern and just allergens that we need to keep a close watch on. So if we look closer at at seed allergy, we see that sesame was reported as an allergy by 336 respondents. And really, if you look at all the data we've collected, this equals about 5% of all the allergens that were reported to the registry. So once we map all the categories for all the allergens that we're collecting data from for the registry, we start to paint this picture. And it's important to note that by studying all the subgroups of food allergies, and not just the top 8, the registry can provide a broader understanding of the food allergy disease. But again, we need more data. Now, a question, I'm sure a concern that many of you have is that when you're participating in the registry, whether your personal information will be revealed to anyone we share the data with, or even to third parties? And the answer is no. And I really want to drive this point home. Your identity remains anonymous, and the data that we share is only shared in a de-identified fashion. And we do this by assigning all participants of the registry a random code. So all the personal identifying information for each of those patients is removed, and then it's replaced with that code. So the only identifying item that's ever used when anyone accesses that data is that random code. Okay? So how exactly do we also protect your privacy? Well, first of all, and I can go back to the last slide for this, all the information that we collect in the registry is protected by the HIPAA privacy rules. And if you remember, HIPAA provides federal protections for individually identifiable health information. So that means that we can't share your information without your permission. But we also have some of the features in the registry that we've implemented to secure your privacy and protect your information. As I said before, all the data sharing is done in a de-identified fashion. And we've also established participant-controlled communication and contact. So if you choose never to be contacted by anyone, that would be a priority. But also your data is stored and maintained in a secure and password-protected database that is also HIPAA compliant. And you'll see when you get to the registration part of the registry that the passwords that we require are very specific. So it might be tricky for some people, but just follow the instructions and you should be okay. But also the infrastructure on which the registry is built upon is managed according to FSMA guidelines. And also the software that manages access to the data is also FSMA compliant. So we've included some of the best securities into our registry for protecting your information. And we did this by using a platform hosted by a genomics company that's called Invitae, and many of you might not be familiar with this company. And we chose Invitae because it has the best securities in place for protecting patient information. They do a lot of work with the NIH, especially working with their rare disease registries. And so we can leverage some of those FISMA audits that the NIH performs for compliance to ensure that, once again, our registry has some of the best security features available. So I want to close just by saying that the benefits of patient registries to both patients and healthcare providers depends on the participation of the patient. And again, this is why we created this registry to be patient-centered. And the point here is that registries are only useful if they contain enough information and enough data for patients, from patients. So we need as many patients as possible to participate. And the question here becomes, what can we learn from the data? That is, from patients' personal experiences. So again, to know this, we need patients to be engaged. We need patients to take the time to answer survey questions and answer questions in surveys that are important to them. So if each patient told us their story, we can use all that data and draw the big picture and learn what works and what's important for patients. So just remember that signing up is easy. It's very quick. It takes 15 to 20 minutes, and it's at no cost to you. This is a link to our website. So again, it's foodallergypatientregistry.org. And thank you for your participation.
Awesome. Wonderful. Thank you, Louis. That was a really great overview of the basics of the patient registry and kind of why people should be encouraged to participate. Some really interesting highlights about the data. I know I enjoyed seeing those. And then also kind of some of the main questions and concerns that come in about any registry, I believe, in regards to the security and privacy. So I think you did such a great job explaining. We only had a couple questions come in, and you actually answered most of them as you went throughout your presentation. But one, if you wouldn't mind touching on real quick, one of the attendees asked if you could explain a little bit about what FISMA guidelines are. They weren't familiar with those.
Right. Yeah, FISMA and HIPAA, they're going to be new to a lot of patients. So FISMA is the Federal Information Security Management Act. It's a mouthful, excuse me, of 2012. And what this is just a requirement by each federal agency to develop, document, and implement programs to provide information security, and also to provide guidelines for securing the content and the operations and management of that data. Now, what's important about FISMA, though, is that FISMA is, or the protections facilitated by FISMA are more extensive than HIPAA. And, in our registry, we have both, both certified by HIPAA and by FISMA. So it's a very secure platform to use.
Wonderful. Thank you. Okay, so I think that wraps things up. I'd like to once again give a big thanks to Louis for joining us today and providing some really valuable and interesting information on FARE's Patient Registry. This registry has a huge potential impact to make, positive changes in the food allergy community and really advance advocacy and changes in legislation, as you showed before in one of your previous slides with just even the number of sesame food allergies that we saw up on the screen. So if you have any questions that come to you after this webinar, feel free to send them to patientregistry@foodallergy.org if anything comes to you later today or in the future. And then also, as a reminder, this webinar has been recorded. We'll get this up on our website in about 7 to 10 days. So yeah, thanks again to all of you in attendance and for joining us. We hope to see you again during our next live broadcast. Have a great day. Bye-bye.